Hello everyone, Dr. Mandy here to talk to you guys about prolotherapy. Prolotherapy is one of the main treatments that we offer at Proactive Health Group, and we've had really good success with it with a number of our patients. So we wanted to share a little bit about it with you guys today. So prolotherapy is a regenerative injection therapy that targets joints specifically. There is other uses for it, but at Proactive Health Group, we are mainly using it for joint pain and joint injuries. So it has many different mechanisms of actions. I'm not going to go into a crazy amount of detail with all of them. I'll just give you guys a brief description today. But the main premise of prolotherapy is targeting your immune system. So we're creating a signal for your immune cells to go to the area of injury and do the healing cascade. Our body has an incredible ability to heal itself. Joints aren't as good at it because they don't have a direct blood supply, but we are trying to help joints along by stimulating blood flow to that area so your immune cells can do most of the work. Dextrose and propane are the two main components in the solution of prolotherapy, and that's what's being injected into the damaged joints. So dextrose has many different mechanisms of action. It's just sugar water, but it's part of the structure of connective tissue. So we're providing the building blocks. And dextrose also binds to what's called the TRPV1 receptor on nerves and decreases nerve inflammation. It works other different ways, but we'll leave it at that for this video. Propane is a local anesthetic, so it does create some numbing. And it also breaks down into two components, which are nerve nutrients. So we're really tackling the nerve irritation that occurs with joint injuries and overuse with prolotherapy. Another main mechanism of action of prolotherapy is the actual needling. So with the needling, we're creating a bit of micro trauma in the tissue to stimulate blood flow to that area. So in order to have successful prolotherapy treatments, we really rely on the skill of the practitioner, so making sure that we're using proper needle technique, getting the solution exactly where we want it to be. And we also rely on the health of the patient. Because we are targeting and signaling your immune cells to go to the area and heal the tissue, we're kind of relying on you as the patient to have a good functioning immune system. So this is why we don't recommend getting prolotherapy if you have a cold. This is also why we wouldn't want to inject numerous joints all at one time. We don't want to water down that immune signal. But this is also why a lot of the patients at Proactive Health Group are really great candidates for prolotherapy and get really good results with the treatments, is because a lot of you guys are generally really healthy. You don't have a long list of chronic diseases, you're not on a whole slew of medications. You're pretty healthy and active, and you just have joint pain or joint injury that needs to be treated. So that's prolotherapy. Hopefully you found this video informative. And if you did, give it a little double tap for us and comment below if you have any questions. We will be making more videos about the logistics of prolotherapy and as well how to determine whether or not you're a good candidate for this treatment. Take care, guys.